Welcome to Sri Ram Medical College. Today we will explore dialysis technology and nutrition, ensuring adequate nutrient intake during treatment. Dialysis is a medical treatment that is used to filter waste products and excess fluids from the blood when the kidneys are not functioning properly. Dialysis can be performed using different technologies, including hemodialysis and peritoneal dialysis. There are a lot of adjustments to be made as a patient commencing peritoneal dialysis treatments. Your doctor has probably already advised you to make some dietary adjustments. The food you eat has a major role in your recovery process. Now that your kidneys are failing, your body has specific requirements. Therefore, you should decrease your fluid intake and make dietary adjustments. You can get assistance with meal planning from the renal dietitian at your dialysis center. Hemodialysis involves the use of a machine to filter the blood outside of the body. The patient's blood is pumped through a filter, called a dialyzer, and then returned to the body. Hemodialysis requires bloodstream access by a fistule, graft, or catheter tube inserted into a large vein in the neck or chest. Hemodialysis is typically performed in a dialysis center or at home with the help of a trained healthcare professional. When the protein in the foods you eat is broken down, a waste product called urea is produced. There may be too much urea in your blood because your kidneys can't filter it out. Managing the urea level requires attention to both food and dialysis. Some water-soluble vitamins might be lost during dialysis. Vitamin and mineral supplements may be suggested if your diet is not providing enough of these nutrients. You should only consume what has been prescribed for you. Dialysis patients shouldn't take any supplements that contain these vitamins and minerals. When your body eliminates urea, it also flushes out proteins that usually float about in your blood. For this reason, it is recommended that you increase your protein intake. The quality of the protein you consume also matters greatly. Each meal should include a serving of high-quality protein. It is found in foodstuffs from animals, such as eggs, fish, poultry, and meat. Consumption of poor quality proteins should be restricted. It is derived from cereals and vegetables. Peritoneal dialysis involves the use of the patient's own peritoneum, lining of the abdomen, to filter the blood. A solution called dialysis solution is introduced into the abdominal cavity through a small tube called a catheter. The dialysis solution absorbs waste products and excess fluids from the blood and is then drained out of the body through the same tube. Peritoneal dialysis can be performed at home and does not require access to the bloodstream. Dialysis patients' protein intakes should be increased. Maintaining an adequate level of protein in the blood is important for good health. Protein also aids in the speedy healing of wounds, the strengthening of the immune system, and the general improvement of health. Consume 8 to 10 ounces of high-protein foods daily, such as meat, fish, chicken, fresh pork, or eggs. Both high and low intakes of potassium, a mineral present naturally in foods, can be harmful to the heart. Dry fruits, dried beans and peas, nuts, meat, milk, fruits and vegetables, and salt alternatives are all good sources of potassium. Your medical team will be keeping a careful eye on your potassium levels because of how harmful they are for your heart, whether they are too high or too low. As a naturally occurring mineral, sodium can have an impact on blood pressure. It's prevalent in things like fast food, table salt, canned goods, and processed meats, cold cuts, hot dogs, sausage, bacon. A regular diet may be maintained during peritoneal dialysis. Keeping an eye on your salt intake might aid in regulating both thirst and water retention. It could also reduce your intake of sugary drinks. If you need help managing your fluid and blood pressure levels, your doctor will prescribe the appropriate dialysate for you. You can find phosphorus in anything you eat because it is an essential mineral. It's abundant in foods like milk and cheese as well as almonds, dried beans, and peas. Intake of phosphorus-rich meals can lead to calcium loss from bones because the body must compensate by taking it from other tissues. A weak skeleton is more prone to injury and fractures from normal daily use. It's possible that you'll need to take a phosphate binder in order to keep your blood phosphorus levels under control. As directed by your doctor, take it at mealtimes and between meals as well. There are protein sources that are low in phosphorus, and your kidney dietitian can tell you what they are. Proper nutrition is important for patients on dialysis because their bodies may not be able to process nutrients properly due to kidney damage. Patients need to follow a specific diet low in certain nutrients, such as protein, phosphorus, and potassium, and may need to take supplements to ensure they are getting enough of other nutrients. A healthcare professional, such as a registered dietitian, can help patients on dialysis develop a healthy and balanced meal plan. You can eat as much as you like unless you are trying to lose weight, in which case you should restrict your calorie consumption or regulate your carbohydrate intake to keep blood sugar levels stable. Calories can be easily consumed through grains, cereals, and breads. Daily recommendations range from 6 to 11 servings from this group. Join Shri Ram Medical College's Bachelor of Vocation in Dialysis Technology and take the first step toward a successful career in dialysis technologist. We are here to assist you in launching your career as a dialysis technologist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Ram Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.